Today my audience is going to be my mom. Did you know smiling is infectious? Many people don't show their teeth when they smile for different reasons. They might not like their smile because of the condition of their teeth. Maybe their teeth are crooked, discolored, or missing, causing gaps in their smiles, making them self-conscious of their appearance. And the condition of their teeth has a lot to do with their self-confidence. In my own personal experience, every day, working with the patients at my job as an oral surgeon's assistant, I see firsthand many different conditions of the mouth and teeth. Most of these cases are bad and require extractions, which is the term for pulling out teeth. We do many extractions at the office. Some of these are even full mouth extractions. For example, a nursing home resident who is unable to care for her own teeth and needs to have them all replaced. Because of what I see at work each day, I am much more aware of my own oral hygiene and eager to prevent problems in the future. Good oral hygiene habits are the keys to a beautiful smile and essential for optimal health. In this speech, I am going to talk to you about what defines good oral hygiene as well as its history. I will also talk about the importance of good dental hygiene and its effects on the body. I will discuss the results of good versus bad oral hygiene and give some interesting statistics. I will also share with you, by using a model, some specific ways you can achieve good oral hygiene and some preventative measures you can take to start on the road to having a healthier, more confident smile. The first point I would like to discuss is the definition and origin of dental hygiene. Dental hygiene is the practice of keeping the mouth, teeth, and gums clean and healthy in order to prevent disease by regular brushing, flossing, and dental visits. Its origins date back to as early as 7000 BC. History points to evidence found in Pakistan. It shows ancient teeth that were found that appear to have lots of circular holes drilled in them. It is believed that these holes were drilled in order to fight tooth decay. It is also believed that these teeth decay was caused by tooth worms, and early dental drills appear to have been small bows with flint drill tips. These would have been used on live patients at the time. Evidence also suggests that the holes may have been drilled for decorative purposes, except for the back teeth, such as molars, where they have not been easily seen. However, there is no evidence showing that these drilled holes were ever filled. According to my research resource, in Egypt there was an Egyptian scribe who was referred to as the first dentist. His name was Hesere. The writing that was found on his tomb has the title of the greatest of those with teeth and of physicians. And in the Middle Ages, teeth extractions were cited as being used as methods of torture. Some extractions were done, however, in order to help a person's teeth ailments, but most teeth problems were seen as being untreatable. Hippocrates wrote about dentistry, mentioning things such as treating tooth decay, tooth eruptions, extraction teeth, and gum disease. Early dental tools used were bows with flint, forceps, and a tool called the pelican that was used for extractions. There were also dental keys used to help hold the mouth open while working on the patients. Some interesting facts about early dentistry was one of the first dental anesthetics was the use of cocaine. Also, a man by the name of William Addis manufactured the first modern toothbrush, and in 1895, the discovery of the X-ray by William Röntgen was the first important turning point in the field of dentistry. My second point I will discuss is the importance of good oral hygiene and its effects on the whole body. I will talk about the good versus bad oral hygiene and also give some statistics related to dental health. It has been reported that there are more bacteria in your mouth than there are people on Earth, so it is very important to keep the bacteria under control. Studies have shown that poor oral hygiene can lead to premature births, increased heart problems, increased risk of dementia, increased risk of diabetes, mouth pain and infections, cancerous lesions, which could be brought by chewing tobacco, smoking, drinking, which could also lead to severe bone loss. Good oral hygiene results in an overall healthy mouth and keeps dental problems at a distance. Prevention is always better than treatment. Good oral hygiene is easy to do and only requires a few minutes a day, but its benefits can be used smiling for a lifetime. Prevention stops problems before they start. This is much less painful on your mouth, as well as your wallet. A healthy mouth saves you money. According to the website cdc.gov, some statistics regarding oral hygiene show that men are more likely than women to develop severe dental diseases. Oral cancers occurs twice as much in men as in women. Young kids getting cavities has increased by 15% over the last few years. 78% of Americans have had at least one cavity by the age of 17. And in 2009, the Centers for Disease Control found that 62% of adults in the United States visit a dentist, and 3 out of 4 people don't change their toothbrush as often as they should. The third point I will talk about is specific ways you can achieve a healthy smile. 3 basic things you can do are brush, floss, and visit the dentist regularly. It is also very important to use the right kind of toothbrush. Soft bristles are the best. Replace your toothbrush after a few months when the bristles become worn and bent. Brush twice a day for at least 3 minutes at a time. Electric toothbrushes are recommended for people who have a hard time using a manual brush, such as children, elderly patients, or the disabled. Try to floss 2 or 3 times a day and take care of the food particles left behind in those hard-to-reach places. And rinse with an alcohol-free dental mouth rinse. Also, it is highly recommended to stay away from sugary sodas and anything tobacco-related. I will now demonstrate by using a model to show you the proper ways of brushing and flossing. First, you should brush with a soft bristle brush, and you would brush at a 45-degree angle all around. Also, when you floss, you can either use dental floss or you can use a proxy brush, which goes just in between the teeth to help relieve all those particles. Now, over the years of dentistry has evolved and advanced in amazing technological ways, thanks to the early scientists and physicians who have paved the way for treating dental problems. A visit to the dentist can now be a painless one. We can now diagnose and treat and prevent many oral hygiene problems that were once considered untreatable. We have also seen the serious side effects of poor oral hygiene has on the body versus the results of good oral hygiene. And now taking a few minutes a day on oral hygiene care can benefit you for a lifetime. I have also demonstrated to you the specific ways you can achieve and maintain a healthy mouth. These tips are good oral hygiene can be used every day. So now that you know how to have a healthier smile and a more confident one as well, do you know smiling is infectious? You can catch it like the flu. Someone smiled at me today and I started smiling too. Thank you.